This film is intended for eye surgeons for training and education purposes. Viewer discretion is strongly recommended. Now, how do we learn horizontal chop technique? Well, this video is a small tutorial, especially in eyes with softer cataracts. Hi, I'm Dr. Deepak Megur, and let me take you through a couple of cases of soft cataracts and how horizontal chop technique can be learned. For most beginner surgeons, horizontal chopping technique is much more intimidating compared to learning the vertical chop, simply because for the horizontal chopping maneuvers, the chopper has to go beyond the rhexis margin and go and hook the equator of the endonucleus. And that, for most of the beginner surgeons whom we train, find it very intimidating. So let me share with you 4 tips on getting started with the longitudinal chop technique and how can we make the learning process much more safer and quicker. And of course, it does help to practice this mentally and physically with your own finger before we actually do it in the microscope. So this is a case where the cataract is quite soft. There's excellent red glow. A tip for all the beginners is, even though we have excellent red glow, it would be better off to stay in the capsule so it's much more easier to identify the rhexis margin, and the beginner surgeon can be very much sure that the chopper is under the rhexis and not above it. So you have to have a decent sized capsulotomy opening, and then a stained anticapsule does help to visualize things better and to ensure that the chopper has gone beyond it. The second important thing would be, apart from doing an hydrodissection, it would be of great benefit if we also do a hydrodelineation so that we can really know the edge where to hook the chopper. So the principle is, when we hook the chopper, the surrounding epinucleus is going to give us some safety cushion to prevent any inadvertent damage to the posterior capsule. So that's the idea of doing in hydrodelineation, especially when we're doing this horizontal chop technique. The reason is simple, because we are working from periphery and the chopper is not significantly far off from the posterior capsule. So having an underlying cushion of epinucleus and cortex does provide some safety. Number 3 would be to use a blunt instrument, not a sharp chopper. So typically we have the Chang chopper, which has a curved edge, but for most average grade cataracts, even a slightly longer Sinskey hook will do the job. I'm using a long Sinskey hook here in this case, and let's see how things turn out. Before we actually perform the horizontal chop technique, let me just demonstrate the maneuvers. The phaco tip is going to stabilize the nucleus. The tip is buried into the substance of the nucleus in the subincisional area or just above it. And then the chopper, which is hooking the endonucleus, is going to move towards the phaco tip. So this movement itself is going to split the nucleus with very little stress on the bag and the zonules. The hand movement is, the left hand is moving towards the phaco tip. This is the maneuver which is going to be practiced. So here we are not lifting up the nucleus, or the chopper is not going down and then laterally as we do in vertical chop. So after understanding these maneuvers, let me take you through the actual process of horizontal chop. We begin by aspirating all the superficial epinucleus and the cortex so that the underlying endonucleus is laid bare. So we begin the horizontal chop by first placing the instruments. The first thing I would prefer is always to use the dialer or the chopper, proceed under the rhexis margin, hook the endonucleus. I would then bury my phaco tip into the substance of the nucleus. The tip is going to stabilize the nucleus, and then my left hand, the non-dominant hand, with the chopper is going to move slowly and steadily towards the phaco tip. And as it is moving through the core of the nucleus snaps and you have 2 complete fragments. At this point, let me pause here and just replay this moment. One thing to keep in mind is, when you're trying to stabilize the nucleus with your phaco tip, the power which is used to bury the tip will depend upon the density of the nucleus. If the nucleus is very soft, then just using the vacuum itself is going to do the job. But in slightly denser nucleus, it's better to use some amount of power, which would be ideal for that density. The nucleus is then rotated. The one heminucleus is brought opposite to the phaco tip. This heminucleus is again subject it to division. We want to divide into 3 smaller fragments. The same maneuvers, that is, the chopper goes in behind the rhexis margin, hooks the endonucleus, and then comes towards the phaco tip, and we have a crack in the endonucleus. The same process is continued so that we have 3 fragments. Now it's time to pull them out of the bag and then consume it. The nucleus is rotated. Actually, practicing the horizontal chop on the second epinucleus is much more easier because the nucleus can be pulled centrally. You got much more easier access to the equator of the nucleus, so it's far more easier to divide it. The 2 fragments are then consumed at the plane of the rhexis margin. Now we're left with epinucleus. We tweak the settings a little bit, working on slightly lower power, and the epinucleus is then flipped out of the capsule bag and then emulsified. Now let me take you through another case, which is an ultra soft cataract. Probably it would be nuclear grade 1 or 0. The rhexis of an adequate size is done, hydrodissection is done, and then hydrodelineation. We have this golden ring. The nucleus rotation is confirmed. Time to do the horizontal chop. So before that, we need to remove all the superficial epinucleus in the cortex. Again, I'm going in with a blunt Sinskey hook, which is maybe slightly longer. Most Sinskey hooks would do the job in soft cataracts. In soft cataracts, the trick is not to use any phaco power, especially in these ultra soft cataracts. So in trying to bury the phaco tip, the power is used is 0. You're just trying to hold it and stabilize it with just the vacuum. It's something like a compression fracture. So my preference is always to place the chopper or the Sinskey hook at the level of the equator of the endonucleus first, and then try to go in and stabilize the nucleus with my phaco tip. The tenting of the anticapsule is one sign which we need to look at, just to ensure that we are not above the anticapsule, we are under the anticapsule, because this is one of the complications. Otherwise, it could be a disaster if you go and do a chopping maneuver at the capsular bag. So look at the tenting up of the anticapsule. That should ensure that you're in the right plane. So I'm not going to use any phaco power, just with vacuum and stabilizing the nucleus, and the Sinskey hook just moves in the direction of the phaco probe, and then we have a snap. Because this is an ultra soft cataract, the vacuum seal is not so perfect. There is some wobble, but it does the job. So in these soft cataracts, just dividing them into 2 halves and pulling each of the half out of the bag is good enough. So taking care of the soft nuclear fragments is a child's play. So getting it out of the bag is the initial challenge, and once you divide it into smaller fragments, we don't have the obstacle of the rhexis, and these pieces can be maneuvered out of the bag and then emulsified. To summarize, it takes a little bit of an effort to practice it. What are the tips to start learning these horizontal chop maneuvers for beginner surgeons? Number 1, right case selection. Try to select grade 2, grade 3 nucleus, which is not too hard, not too soft. Number 2, try to get an hydrodelineation so that we know where the edge of the endonucleus is. A visible golden ring is definitely helpful, and it's a good guide for us to go and place our second instrument to hook the endonucleus. Point number 3, that is trying to learn to place the chopper at the equator of the endonucleus by traversing under the rhexis margin, is something which we need to learn. Even for your regular conventional cases like stop and chop or 4-quadrant technique, try to go and feel the edge of the endonucleus with your chopper under the rhexis margin. You need to get that feel of reaching out to the equator of the nucleus. This is the most intimidating aspect for a beginner surgeon. Once you're comfortable of introducing the chopper under the rhexis margin and reaching up to the equator of the nucleus, the next step would be much more easier. The stabilizing the nucleus with the phaco tip is not difficult. Only thing would be choose the right power for that density of the nucleus. That will take a few cases for you to just adjust your machine parameters or the power parameters to that density of the nucleus. So with these 4 points, I think we can make a learning curve of horizontal chop technique much more safer and quicker. Thank you for watching and hope you found this helpful.